There's a number of things that may play a role, but by far the most important and common thing are allergies. So skin allergies, and as an extension of the skin allergy, the ears are inflamed. If you look at it the other way around, 80% of dogs with atopy will have an ear inflammation and possibly an infection too. And the external ear canal is, you can still say it's part of the skin. It is actually just an extension of the skin as an organ. So that's why it's commonly affected. And in some cases of atopy, ear inflammation may be the only sign.
Very warm welcome back to the Paws Effect Podcast. I'm here with Dr. Pieter Hanekom, head vet of Hillcrest Vets. And I've roped you into another conversation, a clinical case, which is always one of my favorite discussions.
Right.
And I've had quite a few questions recently. I think it's clearly the time of year, but a lot about itchy skin and a lot about ear infections. And so I thought, what a great topic of conversation, because these can be really frustrating cases, both for veterinarians and owners, because, well, we can discuss it as to why, but they don't always go to plan and they don't always resolve fully. And so I thought it would be nice to just give an insight into how we manage the cases and how owners can contribute to try and get their pets right. So I think the obvious starting question has got to be, what is otitis? What does it mean if your vet diagnoses your pet with otitis?
Right. Okay, so maybe if you go back one little step and just mention that the ear canal is where the problem usually is. And the ear canal in dogs in particular is much longer than it is in humans. It also is made up of two parts. The external ear canal is made up of two parts. You've got a little horizontal piece, and then you've got a little vertical piece, and then a horizontal canal. So it kind of bends, and it's really long. And then you've got the middle ear and the inner ear, and then of course the external ear is separated from the middle and inner ear by the eardrum or the tympanic membrane. So what we then often see is inflammation and infection of the outer ear canal. Most commonly, that's what we see, and that is referred to as otitis externa. So that's what it's called, but it just refers to, well, in exact terms, that means inflammation of the external ear canal, and that there may or may not be infection in there as well.
So generally, people come in because they're noticing particular signs at home. And it's not something that we typically go, oh, by the way, these are very obvious signs. What are the typical?
So most commonly, there's scratching at the ears and head shaking. Those are the two most common things, and people are usually quite good at noticing, hang on a second, there's something going on here. We do see some cases coming for something else, and then we pick up, by the way, there's actually an ear infection going on. They're very, very common. Some studies have shown that up to 20% of dog cases are presented to vets because of ear trouble. And that's very high. And then, of course, when you've got hot, humid climates, that increases even more. Some studies have shown that in hot, humid climates, up to 50% of dogs actually have an ear inflammation and or infection going on. So really, really common.
So what is it about climate and humidity that causes the increased incidence?
Well, thinking in terms of ear infections, there's sort of three things that play a role. You have these predisposing factors, and climate is one of the predisposing factors. So a hot, humid climate you tend to get moisture in the ear or have moisture in the ears, and the ear canal not drying out properly creates an environment for an infection to set off. An example of another predisposing factor would be just anatomy. So the big floppy-eared spaniel is the classic example. So that ear flap just hangs over the ear, closes it off. There's no ventilation taking place, and again, that predisposes to trouble inside the ear canal.
So bacteria like dark, moist.
They like it, exactly.
Environments.
That's what
thrive.
they love, yeah. And then you've got primary causes and you've got perpetuating causes too, or factors, I should say, rather. So the primary causes are the underlying reason why the ear canal becomes inflamed in the first place. And there's a number of things that may play a role, but by far the most important and common thing are allergies. So skin allergies, and as an extension of the skin allergy, the ears are inflamed. And most important of the allergies is atopy, which is an allergy to an environmental substance. If you look at it the other way around, 80% of dogs with atopy will have an ear inflammation and possibly an infection too.
So I'm going to stop you there and ask why, because people perceive skin as the covering on their dog's body. Why is it that skin issues impact the ear?
Well, the ear and the external ear canal is, you can still say it's part of the skin. It is actually just an extension of the skin as an organ. So that's why it's commonly affected. And in some cases of atopy, ear inflammation may be the only sign. You may not have the other classical signs of itchiness on the paws or whatever else. You could have only ear itchiness and secondary infections in there.
Fascinating. So the primary causes, obviously, top of the list is atopy. What are the other causes of?
Well, things like hypothyroidism, for example, and then of course you may have some autoimmune diseases. You may have cancerous process going on. So all sorts of other things can be primary causes. But allergies are by far the most common.
Fascinating. So when you have a case that presents, often our receptionists will be like itchy or sore ear. You see that as the title on your next appointment. When they come into your consult room, what is your general approach to managing these cases?
Yeah.
How are you going about
well,
it?
it's actually it can be quite involved because, again, you've got to not just look at the ear, but you have to look at the whole dog or cat. And you have to think about it in terms as a skin disease rather than just an ear disease. So those things become important to look at the entire animal and examine the entire animal. And we got to ask questions about diet and so forth. Definitely, we want to know if this is like a first-time infection, or has this dog or cat, is this the fifth time it's had an infection or what? Those are clues to, hang on a second, we need to look a bit further here. When we examine the animal, then we're going to want to obviously examine the ear canal itself very thoroughly. And sometimes we're going to need to sedate or even anesthetize because it can be very painful.
Yeah.
And to do a proper exam, very often we have to do that.
And you've got your face very close to theirs.
It can be dangerous too. You've got to be a bit careful. Yeah. But we want to know because, importantly, we want to see how the ear canal looks. We want to see what's in there. We want to take a swab, do some cytology and look under the microscope. That gives us an idea of what's actually going on in there. Are there bacteria? What type of bacteria? Are there yeasts in there? Inflammatory cells and so on. And very importantly, we want to know if the eardrum is intact. A lot of these cases that have chronic ear infections, the eardrum may be perforated. And then we've got to be extremely careful what we might use to treat the ear, and we can talk a bit more about that just now.
Yeah.
But so a thorough exam, which we use an otoscope to get right down. We've got to clean that ear canal. You've got to make sure we've got everything out. We've got to look right down to eardrum level and see what's going on. And we may see something else down there, Sometimes you can find a foreign body. Sometimes a big old fat old tick sitting right down the bottom, which might actually be the problem.
Or grass seed or something
like that, exactly.
And then obviously you have cases that are unilateral or bilateral. How does that then impact some of the management? What's more common?
Bilateral is by far more common because it usually has those underlying reasons. So it's going to be both ears. But if it's just one ear, then it's more likely to be something like a foreign body, or perhaps you get some cancers also in the ear canal. So if it's one side only, then your thought process is going to change as to what might be causing it.
So you're taking that swab. What are you then doing with that swab? What are you looking at specifically?
Yeah, so typically we just take a little cotton swab and we roll it on a microscope slide. We look under the microscope And as I said, the things we look for are bacteria, yeasts, which are very, very common, inflammatory cells. Obviously, sometimes you might see some ear mites too. They're fairly rare nowadays, but we still see them. Although you usually can see them with the otoscope because it gives you some magnification.
And that obviously is going to direct your treatment, which we will give an indication about. So. Hi there, pet parents. This is Dr. Cara, the UltraPet vet. I'm excited to introduce UltraPet's premium recipe for miniature and small breeds. UltraPet's smaller kibble size combined with calcium and phosphorus helps keep their teeth in tip-top shape. We've added omega-3 to support their heart function while keeping your little one strong and healthy. UltraPet has included chondroitin, glucosamine, and green lip mussel extract to help your dog's joints and L-carnitine to manage weight. Prebiotics play a crucial role in maintaining a healthy digestive system by nourishing the good bacteria in your dog's gut. The best part? UltraPet offers a 100% money-back guarantee. Visit your local vet or pet store to make the switch now. The next step obviously is dependent on what you see. For example, you were telling us how important it is to make sure that the eardrum's intact. What is it that happens that changes your course of action if you've discovered that eardrum is not intact?
Yes. So if the eardrum isn't intact, then obviously whatever you put in the ear can then access the middle and the inner ear. And so in the inner ear is where very important structures like the cochlea and the vestibular apparatus, which partly controls balance in the body, are situated. So if you put things in there, it may damage those structures, cause permanent deafness, disruption of the balance system of the body, and so forth. So it can have serious consequences. So I'm going to be very, very careful. A lot of the medications that are out there and available to use are not safe to use when the eardrum isn't intact. So we really want to know. Now, I say we really want to know, but even in some cases, it isn't actually easy because some cases, may be so chronic that the ear canal is so swollen, you can't actually get down there, you can't see. So if we have doubt if the eardrum is intact, we're probably safe to assume it might not be. And again, be very, very careful what products are used, either cleaning products or medicated products.
So anything that goes topically down the ear has got to be reviewed. So let's start with the best case scenario, which is, you see whether it's bacterial mixed population or a yeast infection. It's the first time. Most of the time, your course of action is to prescribe some medication to manage that. Yeah. What is the level of responsibility, and how do owners cope with going home with that treatment?
Yeah, so it's going to depend a lot on the owner and the patient. So there are some dogs that you cannot get eardrops in. We can't, and the owner won't be able to. And then you've got to make other plans, and you've got to work around it and try different things. But for the most part, I certainly always put it in and demonstrate to the owner how to put it in. Thankfully, there are some good, nice products nowadays that are easier to apply.
And less frequently.
That
product was very helpful of not having to do it twice a day.
Definitely, yeah. And so I usually demonstrate to the owners how to do it. And it seems like most people are quite capable to do it. Of course, I don't always know if they're doing it exactly correctly because I'm not there to watch, but I'm hoping. But generally, we would always get a patient back for a check-in anyway to see, how things going. Is it going according to plan? Is that infection clearing up?
So let's talk about that, because there are two things I want to discuss next, because I think it's important we do it early on. One is that returning visit and why we ask owners to come back.
Yeah.
And then I suppose we can tie it together, or you can answer them separately. Why we are not prepared to give medication for an ear infection, despite the fact that it was only a few weeks ago that your pet had that. So firstly start with, why is it that we ask owners to come back?
Yeah. Well, obviously you need to know, is your treatment working? And if it's not working, you're going to rethink, why is it not working, and make other plans. Number two, even if it's a recurrent infection, it may not be exactly the same as the last time. You may have had a more a fungal infection or yeast infection, and now you've got a bacterial infection. And then again, the eardrum, the intactness of the eardrum, you don't know if it's still intact now or not. It may not be. So what you put in before may now not be appropriate any longer.
Absolutely.
So it's better to be really, really careful
cautious.
and err on the side of caution when you
you're checking
do these guys.
for resolution at the second consult. Do you repeat the ear roll smear? Do you look?
Yes, yeah. I will always repeat the smear and have a look.
So you're looking for complete resolution, because I think one of the things that owners, from my experience, are not aware of is that the potential for not fully resolving. Can you explain what happens if you're nearly there? So you've been managing, let's talk bacterial, because it's easier for owners to imagine a bacterial infection, and it's looking so much better, the dog's happy for you to treat it, and then you go, it seems fine, I'm going to either discontinue the medication, and it's like, seems fine, or I'm not going to necessarily return for that checkup because they're fine. It's so much easier to take something when you're not well than when you're feeling fine. You forget. So why? What is it that happens if it's not fully resolved?
Well, you may just be under-treating, and you may have to just extend the time that you're treating. So, these things are sort of arbitrary, or you put it in for 5 days, or you put it in for 7 days, and you read the instructions on the pamphlet that comes with the medication. But that's not written in stone, so each case may be different. And of course, if there are underlying causes and you didn't address them, you may get things a bit better, but as soon as you stop, it's just going to relapse again. We're going back to those allergies. If that dog does have an allergy and you don't treat the allergy, then you can forget that you were ever going to resolve the infection. It's going to get a bit better, but as soon as you stop the medication, it's going to get worse again. So you will never win.
So the actual integrity then of the skin that lines down the ear canal is compromised, which obviously, as you were saying, affects the likelihood of these infections in the first place, but also the resolution. So you're having to manage the two together, with things to manage the inflammation and then things to manage the actual infection itself. Mm-hmm. What I want to ask is, do you see pets who have chronic conditions over time have difficulty in terms of the effectiveness of the medication? Is there any sign of any resistance that's building up? Is it something that owners need to be worried about?
Yes, unfortunately, that is a problem. There's certain types of bacteria have definitely developed resistance, and they may not. The usual medication may not work at all. So if we have infections that are refractory, then we start thinking about maybe doing cultures of the ear to try and see exactly what bacteria we've got in there, and do antibiograms, which is where you test different antibiotics to see which one may be beneficial. Now, I've certainly had some which, when you do a normal antibiogram, they would be resistant to everything, in particular one bacteria called Pseudomonas, which is a nasty one. So they can be really horrible. And then you may have to think out the box, so to speak, and do other treatment modalities.
So managing the conditions in the ear is obviously critical, from whether it's allergy-based or, like you say, even a conformational thing where you've got a floppy ear. A lot of and we deal with humidity in this area. A lot of my cases that I saw historically were dogs that used to swim.
Yeah.
How do you deal with those pets? What is the recommendation?
Tricky one.
Yeah.
Some dogs just love sitting in the pool all day long when it's a hot day, and yes, getting the water in the ear. Yeah. It's one of those factors which play a role. I don't really have an easy answer for you. Do you have an answer?
Well, I think my line of questioning was going to go, I think we have owners who want to be really proactive. And I'm asking more because I was mulling over what my recommendation would be, is that some people go, should I be cleaning my dog's ears? And with our conversation of moisture, humidity, conformation, you may actually be setting up a situation which is doing your dog a disservice by interfering in an environment that is currently healthy.
Yeah.
So the kind of things that may predispose them, obviously allowing them into the pool, or getting their ears very wet when you're shampooing them, or using the cleaners because you have good intentions. Everyone's going like, oh, brush your dog's teeth, clean your dog's ears and their eyes. When do you advise owners do use the ear cleaners, the over-the-counter ear cleaners? When is it appropriate to use and when is it not?
Yeah, I'm definitely a bit cautious with the ear cleaners. I wouldn't use an ear cleaner if in a healthy, normal ear, there's actually no reason to put anything in there, to be honest. So I would only advise using an ear cleaner if you have an actual reason to use it. So if you have an excessive serum in there, you can do it. If you have any kind of infection and you've got discharges in there, you need to use it because you can't just plop your medicated preparation on top of a bunch of gunk. You got to get that out of there. So then you've got reasons. But yes, I'm certainly not a fan of just sticking an ear cleaner in there for whatever reason.
I agree. So we're now talking the chronic cases, the ones that have just had ear infection after ear infection. I mean, you said very clearly that what happens obviously over time, recurrent infections, is you have to deal with the primary underlying cause. But we have had cases where, we've all seen, when in a multi-vet practice, you go, oh, I've got, so-and-so back. And like, oh, well, I managed that not that long ago. What is the solution? I mean, for these owners who are listening to this podcast going, I've done everything, I've tried everything, I've gone to different vets for different second opinions, like nothing is working. What is from a multimodal aspect, if we were seeing this as a second opinion case, other than you said diet and lifestyle, and what are the questions you ask owners that may alert them to things that they perhaps haven't tried before?
Well, those really tricky cases, well, yeah, I mean, some of them are a real bugger. I would definitely go back and review all those things and see, did we miss something somewhere? I might want to do some blood tests. I might want to check if there's other reasons like hypothyroidism or maybe Cushing's disease, maybe something like that playing a role in it. So if those things haven't been done, I'll go back and maybe advise doing those things. But yeah, I mean, they can be really tricky. They can be difficult.
Do you put
some cases don't come right.
Do you put them, for example, on particular diets? I mean, are you quite strict with owners, despite the fact that there may not be a correlation between an itchy ear or an ear infection with, say, a parasite issue? Do you go to that extreme with your owners and say, we've got to cover all of these grounds, no swimming, careful with washing?
You may want to do a special diet. You may do a hypoallergenic diet to rule out that possibility as well. Yeah, so you just got to tick all the boxes and try everything. But some of them are still difficult despite that. Some dogs, unfortunately, get to the stage where everything has been done and nothing has really resolved the issue, and the ear canal is such a mess that they need surgery on that. And then it is possible to do a total ear canal ablation surgery where the ear canal is removed permanently. Of course, that resolves the discomfort and the pain, but the dog will be deaf, at least on that side. But sometimes as a last resort, that has to be done.
And some of the secondary things that happen, we've seen hotspots, we've seen swollen ears. What is actually happening there? Let's talk about the secondary things that people may notice and come in for a different reason, and actually it's the underlying ear thing. So what are those things?
Yeah, well, often it will be skin-related issues. So they may have other signs of allergies going on, itches on the ventral side of the body or the feet, around the eyes. It doesn't really matter. But as soon as we think in terms of allergies, then we have to look at the ears. But we sometimes they come in for totally unrelated reasons. And for some reason, either the owner didn't pick up on an issue, or perhaps the dog has just got so used to living with a chronic ear irritation, infection in there that they've sort of given up on. I sometimes feel that some dogs just give up, and it's like, I'm not gonna.
So sad.
It's no point in shaking my head any longer because it doesn't help. It doesn't change. Because certainly some dogs coming in for some unrelated issue, and we find, jeepers, but they've got a nasty old infection in there. Surely, somebody must have picked up on it, but not.
So what happens, explain what happens with a swollen ear, just as we often see these secondary
All right.
issues.
We're talking about ear hematomas.
Yes.
Yeah, so ear hematomas or otomatomas are a frequent complication, if you can put it that way, of an ear infection, because now the dog's been shaking, and with that shaking, that ear flap or ear pinna flaps against the head. Eventually, we got a blood vessel that pops inside the ear, and it starts bleeding, and it fills up that ear canal like a balloon. And sometimes you get a little small area of bleeding, sometimes you get the whole external ear flap that's filled up like a balloon. So that's called an ear hematoma or otimatoma. So when that happens, typically, there's all sorts of methods described to deal with them, ranging from just giving cortisone to doing surgery. We typically will do surgery for most of those cases to drain out the blood and basically attach the skin layer back to the cartilage layer, which is in the middle of the ear. We'll bandage the ear up, and importantly, obviously, we have to treat the actual underlying reason, which is the ear infection.
And then the other one that we see is the hotspot. Explain to the listeners what that is.
Yeah, so hotspots they can also be allergy related. Sometimes they're not. Again, hot humid climates. We get this acute eczema that develops very, very quickly. Can really be anywhere on the body. If they are around the ear or just below the ear, then it can sometimes be a indication that you actually also have an ear infection. And they may have been scratching there below the ear and broke the skin, set off this acute eczema from flaring up. It can be associated.
Sure. Lots of potential issues. So just for some practical solutions and advice for the listeners, in terms of administration of the medication, and I've saved this for later on, so that it's difficult because it's painful. You said that. It's also difficult because what you're trying to do, you can't necessarily see. You can't say 2 drops, because if you can see 2 drops, you're not administering in the right place. Yeah. What is the way in which you help owners make sure that they get the treatment in and correctly and without being bitten?
Yeah, I must say I always have a problem with some of the manufacturers of the medicated ear medicine. When you read the packaging, it tells you put in 4 drops or put in 8 drops, and then it comes with a long nozzle that you're supposed to put down the ear canal. So obviously when the tip of the nozzle is in the ear canal, there's no way you can see how many drops you put in. So to me, it never made any sense. I understand the reasoning. They need to tell you approximately how much you need, but practically it doesn't make sense. So luckily there are some other medications that make it easier, that may just have a little pump on it, and you put a little nozzle down the ear canal and you literally just press the pump and you know that you've got the correct amount in there. So I certainly try and use, as far as I can, if it's appropriate, more of those types of medications to make it easier.
Makes it much easier.
Yeah.
I used to refer to it as the men and the women squeeze on the bottle, but I know some women are also pretty strong.
You don't need
empty
the
dose.
Yeah, but it's a bit of a grayish, difficult area to tell people how hard to squeeze the bottle.
Yeah. And then once the medication, whether it's the pump or the squeeze, is in the ear, is it advisable to try and manipulate the base of the ear to try and get the medication to penetrate, or is it okay just to leave it? I mean, most people?
I usually tell people just to massage below where the ear flap is, because the ear canal is a sort of a little cartilage walled thingy that goes down there. So massage that ear, because you want to spread the medication. Down. Yeah, and it helps to spread it around. So yes.
And then in terms of it's great because some of this medication does have anti-inflammatory properties and things. But how frequently are you having to manage like severe discomfort? Are most of them sort of self-resolving, or do a lot of these cases need additional?
Yeah. So luckily, a lot of the medications that are out there will contain cortisone. They usually have an antibiotic, an antifungal, and cortisone. So cortisone obviously is very good at reducing inflammation fairly quickly, and inflammation is what's causing the pain. But there are certainly some dogs where that may not be enough, and then you would have to look at additional pain medication, systemically, orally, in other words. So yes, certainly some of them are very painful, and you might need other oral. You might need a systemic antibiotic sometimes too.
And do you find owners are reluctant to say they're struggling, or don't want to admit that they haven't managed to get the medication in, either because life gets in the way or they haven't been able to physically do it? Because I remember some pretty snappy, and we've got the advantage where we've got many hands, we've got them on a table, and most owners are trying to do it on the floor.
Yeah, good question. That I wonder sometimes too. We certainly have some clients who will say, "Look, I'm not going to manage," and we usually will tell them, "Okay, please bring your dog in every day, and we'll do it for you." And that's actually nice because then we know it's getting done properly, so there's no problem doing that. But I do, sometimes wonder if they struggle out there. And some people tell me, "Look, it's just me. I don't even have anybody to help me hold the dog." Because really, it's kind of a two-person job to do it properly.
Definitely.
And then I worry, are you really going to get it in or not? But we do have to rely on them to tell us. We certainly will try our best to help in any way we can and get them to come in, and we'll do it. But I think they mustn't be shy to say to their vet, "Look, I'm not managing to get it in." I mean, they need to know. I mean, if the vet's assuming you're getting that stuff in and you're coming back for your checkup and, things are not going according to plan, it may just be because the medication hasn't, got in there properly, and you don't want to jump to the wrong conclusions. So I would definitely encourage people to tell their vet, "Look, I'm really not managing, or I'm not sure I'm getting it in because he jumps around," or whatever. Please tell your vet.
So important, because it may also adjust your treatment plan.
It may affect exactly what you're going to do. You might think, my treatment's not working now, I've got to rethink everything, or maybe start doing some expensive tests which are not needed simply because the medication didn't get there.
Absolutely. And I think, if someone's up front right at the start, you can go either offering to do it or giving advice and giving tips.
Nobody's going to be angry at you because you say, I'm struggling, I'm not managing.
Yeah. I mean,
because we struggle too.
Yeah, I was thinking, when I arrived home yesterday and I felt a mat under the one cat, I was like, I'm going to cut this mat away. And trying to do things yourself is impossible. It's not necessary experience. It's just it's a two-person job.
Absolutely.
So not to be afraid to say to your vets. So in terms of time frame, they've come in. We've advised to do it based on the results of the smear that we've stained and looked under the microscope, directed the treatment. We often administer the first dose to try and get things started. What is the time frame generally that you ask people to come back?
I normally would say, depending on the case, maybe a week seems to be quite a good time frame, because then you've usually completed your course of your topical ear medication and gives you a good idea where you are. So for me, a week.
1 week. And in terms of the chronic ones, the ones that recur, what is the time frame generally that people will go, okay, I accept that there's an underlying condition here that needs to be managed, versus, we're just so unlucky, it's got another ear infection? What is the time frame that you kind of go, we need to look further at the underlying cause?
Yeah. I always ask that question, is if I've got a 2-year-old German Shepherd coming in and it's never had an ear infection before, then I'm not necessarily going to assume I need to look further. But I always look at the record for any case that comes in. I check their medical record before they come in. And if I see on its medical record that this is already the third ear infection in the last year, then I already know there is an underlying cause, there's a reason for it. This is not normal. Any dog can get an ear infection. They are fairly common. But if there is no underlying reason for it, you should treat it, it should be gone, it should be resolved, you should not get another infection in a month's time or in 6 months' time.
And owners, as my final parting question to you, owners often get frustrated with the cost associated with these cases and get really frustrated because it feels like it's going wrong. How do you explain and sort of justify? I don't want to use that term justify because it's the reality of what we have to do in order to get to a certain point. But how do you manage clients' expectations in terms of the cost associated with this? Yeah.
Again, for those more chronic ones that you're now having to manage, an allergy as an underlying cause in particular, those costs can add up and it may be lifelong treatment. So yes, you have to explain it, or we explain it. And there are some owners who can't do it, who don't want to do it. I sometimes tell people, I sometimes ask people if they've ever had an ear infection. I've had one, and it is horrifically painful. So I just imagine sometimes what these poor animals go through. They can't tell us how sore this is. Mm-hmm. But having experienced one myself, it was really, really very, very painful. So we try to make them understand it isn't just an irritation. It isn't just like, oh, why is Fluffy not stopping shaking his head? It's irritating because you're watching TV and the dog flaps its head all the time. No, it's doing that for a reason, and that may be very painful. So keep it in mind for these guys. We got to.
It's not just itchy.
It's not just itchy. It can be, in some cases, it may just be itchy, just allergy without an actual infection. It may just be inflamed. But when there's an actual infection, it can get really painful. So you got to think about that. Think about what that poor animal is going through.
And my last question for you. How do you explain to owners, and it's often over the phone, not to leave these things, how the disease can progress, and in terms of the advice that you give for getting not urgent necessarily, but prompt treatment for these cases?
Yeah, a tricky one there, because I think people usually, once they're here, they're already here. So if they give it
That's what I say. Generally on the phone, it's like, oh, we've got this client, the dog's shaking or sore ear.
You probably should ask that question to the receptionists, because they're the ones who have to answer that question. But again, I would say that an ear infection is an irritation to the dog. It's discomfort. Really not something that I would just ignore and hope it's going to go away.
And it's going to progress potentially to something that will be quite costly.
Well, it could get worse. As I said, if we end up with a perforated eardrum and we now have a middle inner ear infection, those are much, much harder to deal with, much more serious in the end. So,
So be proactive. That's great. Thank you very much. Thank you for taking the time to talk about itchy ears and ear complaints. Very relevant. Appreciate it. Dr. Pieter Hanekom.
Thank you.
Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Oh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.